want to talk about upper respiratory tract infections today. Upper respiratory tract infections, it means having germs or infections in the upper respiratory tract. So the upper respiratory tract is the part of the respiratory system that starts from your nostrils or the nose to the nasal cavity, to the oral cavity inside the mouth, and also to the throat, up to the vocal cords. So upper respiratory tract infections are divided into very many categories and types, depending on the part that is being affected. For example, if the infection is affecting the throat, we call it a pharyngitis. If it is affecting the vocal cords, we call it a laryngitis. Then we also have the common colds that affect the nasal cavity. Very many symptoms can characterize these upper respiratory tract infections. So, for example, you may present with flu-like symptoms, a stuffy nose, a cough, itching in the throat, loss of your voice. The voice may become hoarse. Then you may also present with some systemic symptoms like a fever, a headache, body weakness, and more severe symptoms, for example, vomiting, for example, loss of consciousness, wheezing, and difficulty in breathing can also come as with these upper respiratory tract infections. Yeah. So these upper respiratory tract infections are caused, first of all, by the common germs that we have. So, but mostly viruses. Some of them are caused by bacteria, and these are spread through the air or through aerosols. So you'll find that in most cases, if you're near someone with a cough or a flu, you'll end up getting this infection through the aerosols. So, but also they are transferred mainly through our hands. So in most cases, if these germs get in touch with your hands, for example, as you some people use their hands to wipe their nose, some people use their hands when they are sneezing, they sneeze into their hands, and these germs get into the hands. So if you hold another person or another surface, you're transferring those germs to that surface, and this is how they are spread.